The drug that I'm most excited about right now is trastuzumab deruxtecan. And this was presented, the data was presented at San Antonio in December and published very quickly and got FDA approval on just a phase 2 study on December 20th in the US, which is really truly remarkable. And the reason it got FDA approval so quickly is because of the really outstanding efficacy. In about 168 patients in the phase 2 study, which was also dose finding, and they found the dose to be 5.4 milligram per kilogram. And what they found that was the objective response rate was 61%. Truly remarkable, because 100% of these patients had already had trastuzumab, 100% had TDM1, and about 2/3 had had pertuzumab, so heavily treated, but clearly still sensitive to HER2 targeted therapy. And even more fascinating is only 3 patients in this very large group had progressive disease, so a very, very limited number. And I think because of this truly remarkable data set, the FDA did give accelerated approval, which means it's a conditional approval and they have to follow it up with phase 3 studies, which they've done. And there are 2 phase 3 studies that are randomized, looking at trastuzumab deruxtecan compared to TDM1, for example, to see if we can replace TDM1 in second line, and then also looking at later line, a couple of other combinations in a comparison. So I think we'll probably see this agent move up closer to first line, and also maybe even early disease, possibly because it looks so effective. Now, the negative aspect of it is the toxicity with the interstitial lung disease, and there were 4 patients in that analysis that I described that actually died from interstitial lung disease, and several others that developed interstitial lung disease. So I think we have a lot to learn about that. We need to recognize that very quickly and treat these patients quickly with steroids. Hopefully we will learn how to manage it in a much better way, because this is such a truly effective therapy.